Why did you choose exercise prescriptor? Why exercise?
Try to treat the problem, not the pain.
The biggest mistake that people do is they think that we should treat MRI reports.
We should treat people.
Yes, we treat humans.
Day before yesterday, I consulted one radiologist. They were saying half of the radiology center, they don't have a radiologist.
What you cannot recover through rest is the confidence and the ability that you lost after the pain or the injury.
Yeah.
You give your bike to mechanical shop, mechanic, he didn't study the degree. Did you check the degree and giving your bike to him?
See, even if you don't go for the surgery, the data says you will get osteoarthritis.
Like me, and many physios are joining the physiotherapy courses just to know what is physiotherapy actually.
People talk about flat feet. I always give them example. All Africans have flat feet. Most African athletes I played with, they had completely flat feet.
It's not lying on the bed is rest.
What is the most common problem that you are solving for patients right now?
Means if I say they will do surgery next week, 6 months I can't suffer, but they don't know after surgery they have to suffer lifelong.
I was thinking a lot about your Instagram username. Exercise prescriptor. When it comes to physiotherapy in our country, there is a perception about physiotherapy that ultrasound massage, needling,
Exactly.
cupping. But why did you choose exercise prescriptor? You would have chosen needling prescriptor. Why exercise?
The movement is life. We want to move. Everyone is going in that different direction. So I don't want to go it in the direction.
Yeah.
Simple. We are here to prescribe movement. And one major thing which I found out, a person come with knee pain to me. Unable to climb stairs, unable to sit to stand. Basic, a 40-year-old
Basic functional
female,
movement.
basic functional movement. First thing comes from any doctor's mouth, even my colleagues' physiotherapist's mouth, don't do that activity
Yes.
for a couple of days. The patient itself know that.
Yeah.
If they
You
didn't
can't
move,
do that,
yeah. If they didn't move, they will not get pain because rest is the relieving factor for most of the people. To say that why you have to study, man.
Yeah, correct.
Prescribe movement, make them move, engage, and bring them. They are coming to you just to do that activity without pain.
And not doing that movement is not the solution. That is the problem, right?
Yeah, that's what he was saying.
Doing the same movement also is not the solution. That's why we studied progression, regression,
Yes.
load monitoring, load management, engage them, educate. Is it psychologically a problem? Is it being weak is the problem? Rather putting some word into that, take an MRI. That this ligament is gone. Normal people also have that ligament injury when they take an MRI, right? Then what's the point of? Then lifelong they'll think about the ligament injury. They being so weak in the rest of their life.
Yeah.
And they will admit for some other issue in medical hospital.
No, but we are very aligned there. So our owners at Granimals is the same as what you are doing, is because we are also basically exercise prescriptors, right? Matlab, there is this one thing that we figured out very early going through a lot of surgeries and injuries, that rest can be a relieving factor, but it cannot be a recovering factor.
Absolutely. It
Right.
put you down.
Yeah, it will put you down. You will lose muscle mass, you will lose biomechanics, you will lose neuromuscular coordination, you will struggle, right? And progressive exercise is the only way to recover.
Absolutely.
And I love that we are perfectly lined on that. I saw your page and I was
Absolutely.
like, this guy is the guy.
Bang on.
He's the guy. Like, he knows exactly. He's speaking the same language in a different way. So welcome and amazing.
Thank you.
To hear that.
Yeah, and when you go with a problem to someone and they tell you to go for an MRI, I bet you go for 5 MRIs, you'll get 5 different.
Results. Absolutely.
Results, right?
Because the 5 MRI read by 5 different humans.
Yes.
Yep.
correct. 5 radiologists
Yes.
with different understanding, with different expertise.
Different experience. One radiologist me fought with his wife and very upset with his mood. He could have
ACL tear.
Is it complete tear?
MCL
No,
tear.
and one thing I don't know, I could have said this or not. I have talked to many doctors and big surgeons. I got to know one thing. Even day before yesterday, I consulted one radiologist, and they are saying half of the radiology center they don't have a radiologist.
Damn. So who's doing the diagnosis?
No. This used to be. Did some study in US. 200 people. Sorry, 20 people's one doctor radiologist there. India in more than 200 or lakh people's one radiologist there. So every nook and corner you have a MRI center, scan centers. Do you think everywhere radiologist will be available? I know technological advancement is there. You can send it in the phone. They will look and they will say. But it has to be done with a clinical experience. You have to listen to the patient as well and correlate and return the
Correct.
report.
Correct. That's
Yes.
a big factor.
Yes, before writing the result down, you should actually listen
No.
to.
So the last MRI I got about 3 years ago. I went to the state hospital, PGI, and what they did was they said, "Oh, we've got your reports, but we've got your MRI scans, but I won't make your report until I get your history, because there are certain things that I need to understand
Exactly.
about why this is looking like this. So I gave them my previous MRI reports, then they made my current MRI reports. I loved that.
Have to.
Yeah.
Hospitals are good.
Yeah.
Good quality hospitals are good because radiologists are staying there. Department is there. So they do the things works, because even from my father, I went to hospital, the radiology things, house works, understood. Always say this too, because we have a greater tubercle, adductor tubercle, trochanter, these things and all. Not for patella. We didn't born with patella. We didn't born with every bone with shaped trochanter. We born with flat bones. How you move, it is created.
Correct.
Your finger, my finger is different.
Yes.
Your bone, my bone is different. Your cartilage, my cartilage is different. How can anatomy for everyone same?
Yeah.
MRI shows anatomy, not your pain.
Yes, that's true.
Yep. And the biggest mistake that people do is they think that we should treat MRI reports.
We should treat people.
Yes, we treat humans.
Absolutely correct.
Yeah, that's what we do. We always say that, okay, it is your MRI report. Fine, we can see something there. Let's put it upside down and let's see how you move.
And the big problem with Indian people believing that MRI, because I spent 5,000 rupees. They were asked me to wait for 1 hour, 2 hour, and they were very keen to remove all this thing and putting dresses and all, sending to some room, 30 minutes of full sound of fear. I come out of the room, so some big things were going to come up. Okay, how to trust that report?
Yeah.
Wow, how much you should explain to them.
That's a very good point, you know.
Yep.
So when you put somebody through an MRI process, it's very daunting, is what you're saying. It's because you're already scared.
Yes,
you're already unsure of what is going to
So
happen.
many things happening around you. Yeah.
And then once you get the report, it's also, I think the second part of it is the importance the medical system puts on an MRI report, right? So if I go to a doctor and the doctor says, you know what, I got the MRI simply to understand what is going on there, it doesn't affect my treatment line for you. But in India, a lot of doctors are treating MRI reports, like he said, which is the problem.
Correct. People are not ready to believe even MRI report comes normally. I spent this much, write something and give like that. The attitude is changing.
They're anticipating
Something could have been there. That fear has been created so much. And if the MRI comes very normal and there is a effusion in the knee joint, sir, some effusion, which means swelling. No worry, you're normal. Sir, something problem is there.
So another thing is, in our country, we all believe in God, right? But the only problem is the statues of our gods, they don't speak. But there is this guy in our country wearing a white coat, they speak. So we consider them above gods. And when you walk into that room with an MRI report saying that you have maybe ACL partial tear and some effusion in your knee, and that person in white coat is saying, oh, you're in a big problem, man, you need to go for a surgery, then it hits you hard here.
Absolutely right. But the DR word is respect in our country. That's why everyone fighting for it.
Yeah, that's true.
Yep.
Everyone,
including physiotherapy. That's why I like the people from physiotherapy. Don't fight for it. Do the right things. People will call you dear.
Yeah, that's a beautiful point. Because if you look at the state of physiotherapy in our country, it's basically when doctors pass on a patient to a physiotherapist, that's when patients want to go to a physical therapist. They feel like, oh, it's doctor prescribed physiotherapy, so it has to, like, I need this, right? But the gap is people don't realize that if you're going through pain, the physical therapist, musculoskeletal pain, the physical therapist is the first person you should be going to, right? Because if there is an MRI required, the physical therapist can also prescribe it.
Also, with the help of doctor
Yeah,
or whatever.
it's a team game.
It's a team game. And another thing from physiotherapist perspective, where they are thinking, if you allowed to call as a doctor, people are started respecting easily. So for our job is easy.
Yeah.
That's how everyone thinks. Even you're allowed to call doctor and you're applying the same IFT machine to the patient and expecting the cure.
Yeah.
Don't expect that trust will come once the pain comes back again to the patient.
Correct, 100%.
So my point was that this tag doctor हिंदी में बोलते हैं भगवान का दर्जा है इसे हमारे देश में.
Bhagavan, God, right?
Yeah. So that you'll be worshipped like a god if you're a doctor. So doctors, they need to understand the responsibility that they have on their shoulders. So the first prescription that they are doing should be bang on point. That okay, you need an MRI or you don't need an MRI, go to a physiotherapist. That is very important.
That is very
rather
important
than
also.
just watching the MRI report and
And it's
Yeah,
also
exactly correct.
setting the expectations right. I think that's one thing doctors in our country, most of them, are not doing right. Is you can, if you give a blanket statement and tell somebody, oh, you need to get operated, right? Because you have a complete torn ACL. Now that person is not going to respond to any treatment except a surgery, right? Because you have set that expectation. Whereas as a doctor, if you say, hey man, you're not a professional athlete, you look like you have a high grade ACL tear, still give it 3 to 6 months. Let's see what happens in physical therapy. Then we'll take a call.
Beautiful.
Right.
I'm running on challenge, 100-day challenge, which is 100-day research.
Yeah.
Last 2 days of research paper, I took video and I come here, which is very beautiful. Research paper says that a shoulder supraspinatus degenerative tear above 55-year-old, no need surgery.
Yeah. Okay.
Proven by many research papers.
Okay.
And one research paper beautifully pointed out 493 peoples. They were only treated with the physiotherapy treatment, not required surgery. And they were trying to predict, even someone is going for surgery, what could be the reasons to end up having surgery.
Yeah.
They find out 2 reasons at the end of 10-year follow-up.
Yeah.
2 reasons. Reason number 1, even after 55, you have extreme physical load in your body. You are into sports.
Yeah.
May you require surgery. Second most important aspect of the study is belief about physiotherapy. Doctor told already to you, you have a complete supraspinatus tear. How is going to heal?
Yes.
A patient is not going to believe how physiotherapy is going to fix this man. Then you end up having surgery.
Yeah. Belief is huge. Faith is huge.
Yep, 24%, which means out of almost 500 population which they took, 87 of them went surgery with lack of belief on physiotherapy.
That's crazy.
damn. So yeah, that's our life goal.
Yep.
To your goal and our goal as well.
But the funny thing is, even what people are not even thinking about or asking questions about is, what is my recovery going to look post surgery, right? I'm not against surgery, but if I talk to 100 people who gotten operated, 85 of them come back to me and say, I was better before surgery, right?
But before surgery, they don't know that.
Yes.
What is going to happen after surgery?
Exactly. So my point is, either the person propagating the surgery has to give them clarity on what is going to happen after surgery, right?
But one problem is there.
Yeah.
In many sectors, it's not against doctors. But they are thinking after the surgery, my job is done.
Yeah, of course. That's the problem.
There is no collaboration, as
Yes,
he
it's a
mentioned.
team.
You mentioned clearly with
With the
physical
physical
therapists, doctors, because of ego issue or trusting issue, maybe.
Or it's maybe they don't care.
Yeah, they don't.
Surgery
that
is done.
the-
My
that
job
the
is
root.
done. Surgery should not be get disturbed. Don't move your body for 2 months.
They say that.
Yeah, my
They say
ligament operated part will be good. That's the thing. Most of them are thinking. There are still good doctors which I know are
No,
doing
but-
good stuff. But
No, 100%. There are really good doctors. But imagine telling a patient who has a full tear, the only piece of information you are giving them is, you have a full tear, you need to get operated. Don't worry, 2 months after the surgery, you will be fine. How will the patient be fine? Are you going to get them to the point they are fine? Have you pushed them or guided them to the right person who can get them fine? No education
if you
being
say
done.
that, the people won't come for surgery.
That's true.
Yeah, that's another thing, because people need easy solutions.
Yeah.
Right.
Anyway, I'm not going to get better within quickly, then why I have to come for surgery? They will think like that. And nowadays, mainly for knee surgery, ACL ligament surgery, most of them trying to convince the patients you will get osteoarthritis otherwise.
Yes, that's also very true.
See, even if you don't go for the surgery, the data says you will get osteoarthritis.
Absolutely.
Right.
But surgical population have high risk of getting osteoarthritis. than
Yes,
non-surgical
15-year
population.
follow-ups, yes.
Yeah.
For
Absolutely
sure.
right. On
Because it's an invasive procedure, right? It's an
Exactly.
invasive procedure. They are going into your knee.
factor. They are saying this is because after surgery the load factor and return to sports activity is more also climbing. But your point is also
Simple
very
as
valid.
that, you get weaker.
It's invasive procedure is one aspect, and obviously load is in both cases.
Both
Post-operated, non-operated. So I have an almost complete ACL tear on this knee,
Oh.
right? After an ACL surgery, I tore the graft. It was like a high-grade partial tear of the graft. I did not get operated, right? Now, I have osteoarthritic changes in both my knees, decent amount. The argument can be, I got osteoarthritic changes because I did not get operated. But I got operated on this knee. The ACL is completely fine. I have never had a buckling instance on any of the knees after both the injuries, right? But I have osteoarthritic changes in both the knees. So what is different?
No, I would like to say a very valid point. But even though you are going to get ACL injury or surgery, you are not taking care of your health, poor weight management,
Yes.
lack of strength training, inactive lifestyle, it's going to get osteoarthritis anyway. in
Correct. Yeah.
future.
So science says by the age of 70, every human being in this world will see some sort of osteoarthritic changes
Knee.
in their knee.
But the 70s,
No matter if you have an ACL, meniscus, or knee injury or not.
normal degenerative process
Yes.
of body, but the number is 70, but biologically you are not 70, pushing your limits and taking into 50, 60 alone.
yeah. Because your lifestyle-
your thing.
Yeah.
So you
And
can
he
say
sent me one Instagram post saying strong knees are less painful, even with osteoarthritis.
So there is a lot of research now that is saying even if you have mild to moderate osteoarthritis and even beyond, your pain, your inflammation, your stiffness will be lower if you are strong.
Absolutely.
Right?
It's common sense. I mean,
Exactly.
It's not even science,
people
it's
with
common
grade
sense.
3 osteoarthritis, no pain. People with grade 1 osteoarthritis, they have severe pain, unable to climb stairs or any surgery and all. This difference just because of what you
Strength.
said. Strength, ability to tolerate the load.
See, I don't have meniscus in my either knees. I just had a small piece left in my lateral meniscus, which got teared before Everest Base Camp. Now it gets buckled sometimes. It goes on the side. It gets locked. I know how to unlock it. I unlock it in 2 seconds. And if you see me jumping, running around,
I've seen,
right? I'm getting the load.
The major thing, another thing which we missing, psychological readiness. You are
Yes.
psychologically perfectly all right and ready. You are ready to know what's going to happen my knee, what's my body capable of it, what I have to do, what I can manage, how to come out. No one teaches that.
Yeah.
You have to be psychologically.
And
also
people are
very
not
ready.
stubborn enough to get.
I'm maintaining my end ranges, my knee flexion.
That's too good.
I have hyperextended extended knees, and I still have them, right? And yep, I work on muscle isolation. The only thing that I do is I just isolate my quadricep, my hamstring. That's it. I don't train that much, but still, with no meniscus, if I can do it, I know other people who are doing it, right? So anyone can do it. It is all about your mindset, your psychological readiness. It plays a big factor because I'm always ready for anything. I'm like, okay, I'm strong enough. I can do this.
It's because you never stopped doing it.
Yes.
Yeah, consistently you're doing because maybe it's a habit now for you.
Yeah.
Yes.
Same. My knees are messed up, but when the last time I got an MRI, the doctor was like, "Oh, forget sports. Otherwise, you will have arthritis by 45." I said, "I'm okay with that, but I want to
thinking
play."
like that. I would say stop thinking like that.
Yes.
Your body capable of doing many things.
Correct, 100%.
And people comes and say I have anterior tilt, flat feet, weak glute, and I'm saying that powerlifter can lift 230 kg dead, 200 kg squat and all, come with the complaints of previous physio told or previous doctor told my glutes are weak and core are weak. I have to strengthen.
It's a very generic statement. Everyone says that your glutes are weak.
Very generic.
Okay.
People come to me with an analysis. Oh, doctor did very deep analysis. What did he find? Your this leg is weaker than the other leg. Your glutes are weak. You have flat feet. That's not an analysis.
Exactly. Think about people in Paralympics.
I was about to give you that example. It was in my head. If a girl with no hands can bring a medal in archery, what the fuck is osteoarthritis?
Exactly. What flat feet can limit you?
Yes.
Now thinking is limiting.
Yes.
Correct.
It's crazy. So, why did you choose physiotherapy as a profession?
I like to move. Again, as I said, simple terms. Just after 12th, I search a course a lot, which helps me to engage active, move my body clearly, and I thought physiotherapy is the right thing to do.
Okay, so did you know the pros and cons of physiotherapy career before joining it?
No.
Okay, I'll go for it.
Yeah, this is exercise based, something health, lifestyle, so I'm going.
You know, like I feel like physiotherapy is the perfect profession, not just for people in pain, but also people who want to avoid pain. Right? Because
prevention is the most important aspect which is.
Nobody can understand the limitations of a body like a physical therapist because nobody can analyze in that much detail.
Exactly.
Right? So I think like for your purpose of I want to move pain free and I want to enable other people to do the same, I think physiotherapy is the perfect profession.
Perfect. Use it or lose it.
Yeah, correct.
Principle of reversibility.
So, and how was your experience with your studies and then early jobs?
No, it's like I'm a first graduate.
Okay.
I'm very poor background. And even after 12th, my father was pushing only a person helping me to join and physiotherapy.
Your father.
Even my father. And now he is no more, but still,
props
he's
to
like my family members told him, why you are sending him for the college? Just ask him to do some work. At least he will support the family.
Yeah.
That is the situation at that time. But I fighted. My father supported. Hardly 2013 when I joined physiotherapy, my course fees are 25,000. For that, my father works auto driver. He works for day and night 5 months before every August to pay the fees. And he managed to cross the line 4.5 years. Even I work part time since my 11th and 12th standard. That's where one important thing. After my third year, I decided, so I have to follow my current things. I work in medical shop, that doesn't work for me. Then I went join a part time jobber in gym. My body weight is 50 kg. I was very lean guy, so people will think, look,
he can't train us.
Who is this guy? And slowly I developed myself. One funny thing which has happened, second year of my college, I went to gym first time.
Yeah.
And during the gym, first day of gym, I don't know anything about it. I studied anatomy.
Yeah.
I know pectoralis muscle helps in flexion of the shoulder joint. I went to gym, and the gym master told me, first day you're coming, so, and he told me 3 days you come, enough, you body gain. I thought that this guy don't want me to come, gym is crowded, that's why telling me to come 3 days a week. I think like that. And secondly, he told, first we do chest, full body we do, take the dumbbell, do bench press. He demonstrated. This is for chest. What he was talking. Just now I studied anatomy. Pectoralis muscle helps in flexion of the shoulder joint. And I take the dumbbell of 2.5 kg and doing flexion of the shoulder joint. I'm thinking pectoralis will work more. And he comes, hit in my head, what are you doing? What I said. And then I'm doing, this is work specs better than this. But entire anatomy is wrong or what? And slowly started learning biomechanics and exercise therapy. That's where my movement understanding starts. And slowly grown up after 4.5 years of completion. 2 years worked, 1.5 years I worked immediately I worked anatomy tutor.
Nice.
Anatomy tutor for 7-8 months.
And who were you teaching? Like medical students?
No, physiotherapy student. First year physiotherapy student.
So it was a great example of, how a physiotherapist might look at things when they go to the gym.
That's a beautiful,
that's how it happened, everything. Because no one chooses the job. But I did. But I'm not a right candidate. I agree always. Now, if I think I'm not a right candidate, immediately after passing out to teach students, I'm not the right candidate. Maybe I have confidence to improve myself. I tried the job 6 months. Now, if someone is doing that, I'm against it, really.
No, but it's fine.
I know myself,
people in
it's
the gym,
okay.
People in the gym don't even understand. The people who are actually, your gym master could have been somebody who's exercised for a long time or studied it. But most people training in gyms, they don't know anything. They just know how to do the exercise, what exercises. That's it.
Then after that, I joined cardiopulmonary rehabilitation, lung transplantation was happened. That's where the game changer, man, really. That's where the game changer. I started studying about exercise physiology because I know I can't do PG. I need to pay fees. If I study, I have to study good college. Otherwise, don't study. That's my mentality. So I choose Manipal. But the fees and everything, one patient helped with the trust. So I joined Manipal 2019. 2 years exercise and sports science I did.
Nice.
It's not a physiotherapy, masters in sport. Many people question me as well. Why you're not doing physiotherapy, masters in sports?
No, but it's very smart. We'll talk about that.
I am going to do exercise and sports because I love the curriculum. I want to study strength and conditioning, exercise physiology, biomechanics, physical activity, this thing. But if I go and do MPT sport, what I will do? I go again to the clinical postings. I will see neuro patients, ortho patients, and musculoskeletal. Nothing sports exposure I'll get. Nothing about the sports research I will get. And I want to study it in good college, Manipal. Yeah, that gives me a very good teaching ability, mindset, and everything. And I grown up. That's all it happened and everything.
What we've done here is the same thing. We identified a gap, right? There was a huge gap because doctors don't understand exercise science, physiotherapists don't understand exercise science, most of them, right?
Now, physiotherapists are getting
better.
Picking up.
And I think
good.
we have something to do in that as well.
Exactly.
Right? Because physical therapists are saying, oh, these guys are not even physios, but they're getting results. What are we missing? What we are missing as a physical therapy, I would say profession, is that understanding of how exercise science and biomechanics works and how sport specific training works.
Exactly.
Right? So what you did there was you identified, you did it out of passion. because I like to do this. I like to move, and this is more catered to what I like. What we realized over time and going through a lot of surgeries, lot of injuries is that the profession genuinely lacks it, and that's why people are not getting outcomes.
And it is very hard to accept it from a physiotherapist and doctor perspective and say it out that I don't know it.
Yeah, that's true.
Right?
Absolutely correct.
So that is the biggest problem.
Want to go back and learn. Things has changing. And again, I used this example many times. 2013 articles are published. Reverse Nordic helps to reduce the risk of injury hamstring this much. Sorry, quadriceps injury this much. Nordic reduced this much 52%. Copenhagen reduced 64% and everything. But 2013, the article got published. 2013-14 period only this article got published, injury prevention article. I passed out 2017. I don't know the information. 2018 I learned by myself. Whose mistake?
Yeah, the institutes.
The system.
Whose mistake? System's mistake. Even the staff knows this. Till now, I don't know. Whose mistake? Every engineering college is now promoted. Engineering courses are going down. Every engineering college is promoted to physiotherapy or paramedical courses to sell it. Everyone's thinking about the business. No one thinking about the future of.
No, that's the problem with the system in general, is because it's very old school, it's very theoretical based, it's not research based.
Correct.
It's not practicality based, right?
And my opinion is, if any business, they become customer obsessed, right? So a medical educational institute should be obsessed for their students, right? What is best for them.
Exactly.
And if you think that way and you stop thinking like that, okay, we have to enroll more and more and more students, things will eventually get better.
No, but that's you're talking about the chicken and egg problem.
Yeah.
And in India, it's always. So think about it like this: we have partnered up with some physiotherapy institutes now because we're directly hiring physios. We're directly hiring top physios. They don't care. Most physiotherapy institutes don't care about placing their physiotherapists. They just care about physiotherapists are coming, they're getting a degree. They don't even care that after getting this elaborate degree, that is a lot of hard work, my physios are going to work in an institute for 20,000 rupees, for 15,000 rupees. They don't care. I am going to them and telling them, hey, my team on an average on 60 to 70k and some people on more than 6 figures. Give them to us. They're good. They're like, oh, no, we don't care. We don't have a placement cell. We just do the degree. We don't have anybody in the institute who takes care of that. How is that possible?
So what do you think is the solution from your aspect?
The solution is what you said. Number one, if you want physical therapists to have the relevant information that is going to help them succeed, the curriculum needs to be catered according to that. It cannot be old school anatomy padha diya, basic treatment, conservative sikha diya. What is your physical therapists are getting nowhere because of that. Right.
There is no critical thinking analysis
Correct.
as well. Now Peace and Love came 2019. That's saying optimum loading could have been better. Police came 2014. Optimum loading concepts explained from that, but still book has price protocol.
Yeah.
That's okay to have. But after 2019 to till 6 years, there is no systematic review or RCTs to comparing. Actually, optimum loading alone with icing. Still, ice to give or not is a controversy.
Yes.
So someone saying is no, but it's okay. Where is the proof? Fine. So you are giving ice or not? Just critical thinking.
Yeah.
My perspective of thinking I'm sharing with you. The claim I should not give just because of it not promote healing.
It
Immediately suppress the body
natural
natural healing process. Okay. But I would give ice.
Same.
Sure. At what stage? If injury is so severe,
No.
swelling is so much,
Yeah.
then I would give ice.
100%.
Anyway, it was going to take time to heal. But at the time he has to load. At the time swelling will restrict the movement, I'll give.
That's beautiful. My example, like same. I've had
Critically
the same examples.
think and analyze, create the situation, and in the situation apply the research paper and knowledge which you have and create it in your own way.
It's also about experimenting. Right.
Absolutely. Clinical expertise.
I've done the same thing. I twisted my ankle. I had recently read a research about the same thing. Hey, ice suppresses your body's natural healing response. So ice is bad. Inflammation is good because that means body is healing. I tried it once. It affected nothing. My healing was very delayed. It took me 8 to 10 days to just get the swelling down. Next time I was like, okay, I'll go back to my original method. I was loading day 3, day 4. I was doing seated calf raises. I started doing ankle dorsiflexion and stuff in pain-free range, eversion, inversion. I started doing single leg balance. I started doing bilateral calf raises by week 1. Which approach is better now?
And maybe it is just psychological.
About to say, belief
Doesn't
system.
matter.
Absolutely. A
Maybe.
belief system.
Yes,
A belief
doesn't
system. What
matter.
do you believe? Our traditionally believed ice is going to help. Put ice is going to help you.
Maybe. Right.
If you don't have a very clear confidence and ideology, is very great. One sprain of ankle is not need of ice. I can manage well. Don't give ice.
Yeah. But you have to experiment yourself.
Absolutely.
You can't go by literature only. I think that's one of the weaknesses that I have seen. I am the person
Agree.
who directly oversees a team of 75 physical therapists. Right? I train them on exercise physiology. I train them on exercise biomechanics. I train them on progression. Right? So what the constant gap I see, we had a patient who had a major accident. He fractured his tibial plateau, tore his ACL, MCL, LCL, had tears in meniscus, got a surgery done, and came to us 7-8 years after his surgery. He was still limping. If he sat for a long time, standing up was a problem. Today, this guy runs, jumps, lifts proper weights, does deep squatting, pain-free. Been with this for about 18 months. One of my physical therapists, when I gave him this case, he was the second physical therapist to this case. This guy had already improved, right? From not being able to do nothing, he could do a lot of things now. He was getting up and down the stairs, was squatting, blah, blah, blah. I gave him when he was offloaded to my physical therapist. Physical therapist looks at the MRI reports and says, no. This guy should not train his knees.
Limited thinking.
He will get osteoarthritis. He already has osteoarthritic changes, grade 1, grade 2. He should stop training. I was like, man, you should be chucked out. Because you are limited thinking. You are a person who doesn't see. This guy came at 0. He's already at 40. What is the limitation? Why can't he get to 100?
No, I agree, but I would say one point. Like me, and many physios are joining the physiotherapy courses just to know what is physiotherapy actually.
Yeah.
I didn't get MBBS seat. I didn't get a BDS seat.
Yeah.
Half of them joining like that. Half
Yeah.
of them want to do some courses and doing. Out of 100, 2-3 people are joining physiotherapy, want to do physiotherapy. Honestly.
Yeah.
That's where the problem comes. So, the education system, what teaches? Everyone doesn't have a born talent of critical analysis, thinking, asking questions to your staff directly. Even you're kicked out of the classes, you're not eligible for the exams. No one have the guts. Out of 100, one person may have the guts. So, what they were teaching, they have to believe.
Yeah.
Their teaching system itself saying, don't move, don't do, don't that. That's a big problem.
Yeah.
And out of nowhere, if even my experience, if I meet physical therapist who in that 4 years period of time itself doing some exercise, they have a clear mindset.
Yeah.
They don't have a limited thinking ability.
Yeah.
That's where your point matches. As you pointed out from the start, you have to do exercise. Then only you are a professional. You meet your professional criteria to be a professional.
No, 100%. Without exercise, you cannot understand what is going to happen. Like you said, I was doing a front raise because I thought, I'm training shoulder flexion. This is a better move to train my pectoralis because my pectoralis does the shoulder flexion. But when you did the bench press or dumbbell press, he was like, oh no, I feel more.
Yeah, it's a combination of flexion, adduction, internal rotation, all. Oh, why anatomy didn't teach that?
And I think this is the major reason why people, even after going to physiotherapy sessions, they are still in pain.
Yeah, correct.
Agree.
Correct.
Recurrence of pain will be more because again we are all trying to cure a pain alone. That's a big problem.
Yeah. We're not trying to prove. We have a community of people. The most recent challenge we ran was, what you do is, if you are doing one exercise that you feel like is very hard as a patient, you do that exercise and you tag your physical therapist. Like somebody did a 145-second single leg wall sit. Tag the physiotherapist, now do you do it? Right? So we ran something like this and it was so much
Good
fun.
initiative.
So much fun because there were some certain things physical therapists were able to do, patients were not able to do, and vice versa.
Right.
But now both of them are aiming to be able to do more, right?
Absolutely.
Which is the victory.
Exactly. Do you know, in my team, a run of 25 physiotherapists, everyone next 3 months, Coimbatore, Chennai, back-to-back marathon is coming. Everyone should run. We have set target. We already learned past 3 months, 4 months exercise physiology. Now the practical exam for everyone.
Nice.
Everyone should make their volume, intensity, training plan accordingly. We made it and we have a column chart, everything sit on the board, weekly volume, how much LSD you did, how much interval training you did, make a note of it and everything. This is your target. You're going to run 10 kilometers in 15 minutes. You're going to achieve, I'll provide gift. I set unrealistic target, but you learn through only this process.
No, 100%.
This is what happened in our clinical experience.
That's brilliant.
Beautiful.
Yeah, just
So proud of
and
that.
thank you so much. And another analogy when you said about the pain, why we treat pain. I used to give this to many people, explain to this many people. Person got chest pain, went to a cardiologist, and he found out there is 2 blocks in the heart.
Yeah.
At the end, he treated the chest pain alone. What could have been happened at the end?
What could have?
Happen at the end.
I mean, if he got what did he do? He got a stent.
Yeah, he didn't treat that block and nothing. He gave a medicine for only to reduce the pain.
To reduce the pain.
What could have been happened?
Heart
Heart attack or something could have been. The doctor treating the problem, not the pain. Pain is a symptom.
Yeah. Bilkul.
Why focus on pain? Anyone come in, lie down. As we discussed in the start, everyone at the rest, most of the people don't have pain.
Yeah.
At the rest, making them in a bed at rest, applying IFT, shock wave, needles, cups, how's going to make them move better?
No, that's common sense, which nobody understands. these days.
Sprinter comes with a hamstring pull.
Don't do anything. Obviously, pain will go down.
Hamstring pull, put dry needle. Now you can run. Coaches believed and asked him to run. Now you're not running 100%. You should run 100%. Complete hamstring tear.
Complete hamstring tear. 100%.
Gone. 6 months, 4 months gone.
So the key point there is humans are treating pain because they feel like once pain is gone, I will rebuild the confidence and ability to do my activity. Right? Pain can be relieved just through rest.
That's a big misunderstanding.
Yes. But what you cannot recover through rest is the confidence and the ability that you lost after the pain or the injury. Right? That has to be rebuilt through exercise progression.
People is not understanding what is called rest. A person can lift 100 kg deadlift already. Lifting 40 kg is rest.
Yeah, correct.
Person can run 10 kilometer comfortably.
It's amazing.
Walking 30 minutes is rest.
Yes.
It's not lying on the bed is rest.
Yeah.
Yes.
For everyone.
And most of the physiotherapists and exercise scientists, even they don't understand the model of pain, the biopsycho-social model. They don't have any idea what is it. Right? So people just think that, okay, I have something in my MRI reports, I'll get pain. I have a lot of things in my MRI reports.
MRI reports creating biopsychosocial.
Yes, I don't have pain.
Psychosocially get affected.
And this biopsychosocial model can take the pain away as well.
Absolutely.
Right? There are a lot of things in my MRI, but in my head I'm fine.
Absolutely. But I would give another example analogy to my patients. If I take a pin and prick you 100 times, do you get pain? Oh, I'll get severe pain. But what if you put tattoo?
Yeah, same thing.
What if while putting tattoo,
Yep.
are you getting pain? You're accepting.
Yeah, it's accepted pain for an outcome.
Ah.
Right? But key point there, what you said is, until you are back to doing your maximum, you are at rest.
Absolutely.
Let's think about it like that.
Abilities are different. between
Until I
individuals.
achieve my end ability, I have not recovered completely.
Yes.
Absolutely.
Yeah.
And another important point, once you relieve from the pain, it is not like you're treated 100% correct.
Yeah, that's the same thing. Yeah.
As you said, once you can do the activity which is actually caused you pain, you are doing that activity beyond more than that. Also, it is not getting pain. You treated 100%.
Yes, exactly.
Try to treat the problem, not the pain.
When you're back to being better than you were before, with confidence,
Exactly.
without pain.
Obviously, because your previous condition got you injured.
Yeah, because just as he mentioned beautifully, the biopsychosocial model, the chronic pain, if someone has pain more than 6 months or 1 year, take it in just a back pain or neck pain, non-specific pain, anywhere. After getting MRI, doctor words, stop moving and worried a lot. After your treatment of 3 months also, they will not get better.
Yeah.
When they will actually get better, for example, their objective to bend forward simply, but now they can bend 20 kg. Now they feel confident, hacha, superb. Go home and do this activity, be physically active. Still they will not get better. Once they go home, next 6 months they will not get pain. Next 1 year they will not get pain. Then only they started feel recovered.
Yeah.
They'll forget what the pain which they have.
Yes.
If you explain this to them already, that's called a patient education. Importance of load management. What is importance of sleep? Importance of food, water intake and everything. Importance of movement. They'll take care of themselves.
Yeah, correct.
Most of us again doing the mistake. I put dry needle, the pain is gone. They're thinking physiotherapist in clinics, I treat the pain very well.
Yeah.
But the person after a week got second pain, not coming to you, going to a different therapist.
Yeah, because that's why physical therapists are not trusted. Is most people when they come to me, they say, I went to physical therapy. Initially I felt better, but eventually it was the same. That's the biggest critique of physical therapy, is because it doesn't cause any long-term change.
Exactly. It's not addressing the moment.
Yes. It's
So
not
you need
addressing
to
the root causes.
Yeah, root cause. You need to understand 10 sessions won't fix your shit.
So it's not. It's and another big thing, as I mentioned, you told 10 sessions straight. How it's going to help?
Yep.
Max 2 sessions, 3 sessions max week enough.
Correct. That's very true.
That's how we properly applied right dosage of prescription exercise body needs.
Yeah. And you also do the exercise by yourself.
Ah.
You don't just come here and do 5 machines and 5 exercises every
Agree.
day and expect.
Agree.
But it's the money model. Come every day because they know right now the patient is in pain. They have the highest intent to come. Right now we need to squeeze as much money as possible.
Exactly.
Right? The mindset is not optimized,
Exactly,
right? And then the patient, you mentioned patient education, right? So we are training maybe 2,500 plus people right now at any given point.
Live.
Yeah.
They are live. But the total number is over 15,000 now.
So at
Right.
any given point, now the biggest challenge for us is 2 things. Like you mentioned, patient education is not just a challenge, it's an aspiration. Because on day 1, I want my patient to know, hey, this is where you are today. This is the phases that are going to take for you to achieve the 3 goals you have set for yourself.
Exactly.
Maybe the first goal is I want to squat pain free. Maybe the second goal is I want to jump pain free. Maybe the third goal is I want to run pain free. This is potentially how much time it is going to take, and these are all of the short things that you are going to have to do en route to achieving that goal. Right? That's number 1 in terms of patient education, giving them clarity. Second is for us to be able to tell them, hey, you have not recovered until you can do this with confidence, without pain, without ever thinking. And third is me telling them, I have helped you recover, but you will only stay recovered if you keep doing what you have learned.
Exactly.
If you maintain weight, if you maintain load, if you eat right, if you sleep right, if you don't abuse your body.
There is a demand, there is a goal, you have to do it, you have to follow. Correct. Absolutely right. On point. This is again, we have to set these priorities on the first session only.
Yes.
When the people has pain, they have, again, people itself have limited thinking ability. One of example I can say, very severe ankle sprain, a person unable to walk and comes with me, I have to walk. Please make me walk, at least. I told 20 days of rehab, 8 weeks, it goes 7th week, I'm asking him, how are you? Are you good? Things? No sir, I was still in pain, discomfort. It's very much worried. What you're saying? Why when you have pain? I'm trying to sprint and jump and run, I have pain. You came with how to walk. Then I changed the approach. When you come, what is objective of the consultation? What do you want to achieve? And now I started realizing, this is the experience from the consultation 4 years, 3 years back. So now I started asking them, when you improve, your goal also improve, what is your outcome, end outcome? If you want to play in certain sports, it takes 5-6 months. More than that sometimes. If you want just to run, 3 months it takes. So loading progression also accordingly. Don't give
setting the right expectations.
And that as well, the timeline approach is not good enough, right? If you want to run, you clear these things in 3 months, you run. You don't clear these things in 6 months, you don't run.
Exactly.
That expectation also has to be very clear on day 1.
Exactly. So we have set expectations to them correctly, but sometimes to set the wrong expectation. When I will give a scenario. I'll give a scenario. Yeah. Now, just I will give a wrong scenario. I know ACL tear patients who want to get back to their life. A common man who got injured in bike accident. No one want to play our sports. But doctor said it very strongly, and he has already a practically perfect mind to do surgery. But I know he don't need surgery. Just a partial tear, and he is a common man. Why he needs surgery? To convince them, I will say some wrong things to them immediately. Just give 10 to 20 days to us, rehab. Just one month you give to us for the rehabilitation. Will make you better. But during the process, he will understand I'm getting better, I don't need surgery. Then I will explain to them 3 months it requires.
That's the trick. So it's great because it can come from you wanting to sell. I know it's not coming from that. I know it's coming from you just want the person to see there is a better way.
If I say 3 months, they will do surgery next week.
Yeah.
6 months, if I say they will do surgery next week. 6 months, I can't suffer. But they don't know after surgery, they have to suffer lifelong.
Yes.
Correct. But we do this, I do the same thing, but we still give them a 6-month prescription because Our model is
We tell them on their face.
either you're with us or you're without. You're not with us. It can't be halfway.
Exactly.
But I like what you're doing there.
No, at
because-
least sometimes you have to say to.
I mean,
give us 3 weeks.
It's a learning for us. I mean, it's a takeaway for me as well.
Because our thought has always been, our method is called the last recovery method.
Exactly.
Right? What we mean by the last recovery method is you have to give us the time that you want to, that is going to take for us to help you achieve your end outcome. Right? Whether it's 6 months, 9 months, 12 months. If you commit to that time, if you commit to that goal, it will happen. It happens. Or the best stat that I can show is people who work out 18 to 20 days in a month, right, for 6+ months, 90-95% of those people are achieving either their end outcome or their second end outcome with us. It's just consistency and commitment.
Exactly. Yes, you need a strong team. If I'm saying 10 sessions, but not enough, me and my friend, colleague, physio knows. But they will explain to them and convince them to come for 3 months.
So one question I have is, you mentioned chronic pain. Right now, most of the people, I would say 60% of the people that we get, more than 60%, are people with chronic knee and chronic lower back pain. Why do you think there is and they're young. They're from 28 to 38, 40 years of age. Why do you think this huge increase in chronic knee and lower back pain?
Simple. Already we discussed the problem in physiotherapy and doctor collaboration and education system. Just because every chronic pain starts as an acute pain.
Yeah, correct.
Simple. Acute pain is not treated properly. That's become a chronic. So for example, a person had a knee injury, saw you, and you directly come to you, and you started treating, you got expected good outcome immediately. After 5 years, 5 MRIs, 5 different doctors, 4 different therapists, full of negative beliefs, and started believing my posture is wrong, started believing my ligament is wrong, started worry to put a leg on the floor, comes to you, same treatment, will not get better results. Just because of the previous physios, a previous doctor, the previous information which is told to them is big culprit.
Yeah.
But we should not tell to the patient. I would like to ask both of you, impingement. The word impingement, shoulder impingement. So what is the meaning of impingement? According to you?
I mean, impingement in movement or impingement in...
The meaning of impingement.
Yeah.
Is it not meaning of tingling?
Yeah.
Why patient has to know that?
They don't care about that.
Why we have to give MRI to the patients, films to the patients?
Yeah.
These are all the problems. The physiotherapy word which we use is creating acute pain to chronic pain.
Correct.
The usage of language plays major role.
Sciatica. People think that it is the biggest problem.
Lifelong they will think.
I have sciatica.
Scenario, again I can say one more scenario. A person watching a reel and thinking a sciatica of back pain, it shows an animated video in the reel. The leg has to be numbness and painful. 2 months back, we're sitting on the toilet more than 15 minutes. Just he got compressed here and have some sensation here. After 2 months, he got back pain. He's watching that reel. 2 months back, I got numbness.
Sciatica.
Oh, I have sciatica. But that common man doesn't know the sciatica. You have back pain, at the same time you have numbness.
Yeah.
Simple. But who's teaching that in reel?
Nobody.
Yeah, the problem. These are all the things are this cultural, social media, cultural thing. These are all the things are educational thing. These all things are creating acute pain into chronic. Every patient comes to us, we treat it correctly. Why they're getting affected?
No, but they're not getting exercise prescriptions also so when we, like if we were to create a sciatica post, obviously as a person who's watching it on the other end, you have to tell the person, if you have these symptoms, you potentially have sciatica. You have a nerve impingement. Either it's happening in your piriformis or in your lumbar spine. You have a nerve impingement happening, right? Now this is what you need to do, right? Most of the people that are doing this are just creating a huge deal about you have sciatica.
A patient who really have sciatica in front of you, come and sit, they don't say I have tingling sensation.
Maybe, yeah.
They don't say really this. They will naturally express their problem. When you ask you to bend, they couldn't able to bend. Really, they couldn't able to bend. And they ask you to bend, the knee automatically get flexed.
Yeah.
Stiffness will be there.
Of course, in the
Cuffs knees will produce pain. They'll say I have pins and needle sensation. Feeling. That's a true expression. What the patient explaining from their mouth.
Yeah.
But now most of the true lumbar radiculopathy cases doesn't have more pain.
Yeah, that's true.
Doesn't have more pain. Are people who sitting in front of me and explaining, sir, I have radiating pain, sciatica, and tingling sensation. You don't have sciatica, 90+%, I'm sure.
Yeah.
Because someone told you, watch some reels, you search in the Google or ChatGPT,
Yeah.
you're saying these words. These words common man doesn't know.
Yeah, correct.
Then you have common back pain. What is the reason for back pain? You could have searched the same reel could have pop up within next 1 hour in your feed.
And
You got affected psychologically and you're ready to take an MRI now, right? Already you've taken MRI. Maybe because a first treatment which is given is not successful.
Yeah.
A second treatment which is not given is not successful. If you're going to the doctor, simply who is ready to listen to the patients? More than 5 minutes, which consultation is happening at least? No one is happening. Simple 15 days tablets, not working. Come 15 days later. X-ray. Normal. Even people are nowadays diagnosing sciatica through X-ray. That's worst thing in this world. India is happening. Doesn't work. Then next time, 1 month later coming. Pain is not cured yet? Yeah. No. Then now you have to take an MRI. MRI, disc bulge. For everyone.
It's the same thing.
For everyone. 1,800 people take an MRI.
Sir, I don't have any radiating symptoms. I promise you, if I get an MRI for my lumbar spine, I will have a little bit of a disc bulge. I think most people have a disc bulge these days.
Exactly.
Just too much sitting.
It is unrealized.
Yeah. As a common man, we want to know what is the reason for my pain to get at least satisfied. So now MRI comes disc bulge. How can you going to change that mindset?
Now it's surgery is recommended if it. So you just explained the step to step of how the patient life cycle works. The next step is go try physical therapy. Physical therapist के पास आप गए, basic ultrasounds, IFTs, some stretches, maybe basic loading, right? You felt better initially. In 3-4 weeks, you go back to the doctor. Nothing has changed. I have pain again. Doctor says, "Oh,
Surgery. Fourth step.
Surgery.
Rightly pointed out. Surgery, then more psychologically affected.
Yep. And you mentioned the role of social media, how people are getting affected negatively. But in your case, you have grown a lot. I saw your profile. You have over 170k followers. What role social media played in your life?
No, I would say I will not start the clinic just because I have followers. I don't even have followers. 2,000 followers when I start the clinic at 2021, 22. Because I know I can't work under someone.
Yeah. You have a different mindset.
I can't work under someone. When I started, I don't have followers. Slowly, what I'm started sharing my clinical experience, what I'm seeing from the patients, what we have to do. I know when I open the clinic, I don't have IFT, ultrasound, any modalities, nothing. A patient come with 10 out of 10 pain. A patient come with 10 out of 10 pain. How I'm going to handle? My mind started thinking. I started listening to the patient more, where I can make them better. I'm prescribing, make slight movement. Later I understand that's a motor control exercises.
Yeah.
Slowly I started learning. I would say this to every physiotherapist. One day or 1 week in your clinical practice, all the passive options, or either release, either modalities, whatever the expensive passive option, decompression therapy, whatever you have, everything throughout of your clinic. 1 week start treat the patient. You start realizing your brain works.
Yeah, get into the problem to solve it.
Then you already jump. Now you go back and read. You have to do all the steps.
Because
6
you can't
months.
rely on modality.
6 months changes your life.
Yeah.
The tele-rehabilitation. So I think I'm on point, right?
Yes.
Tele-rehabilitation is the game changer in my life.
Yeah.
Game changer in my life. Because I do release too. Now stopped completely. I'm against the release as well. Okay. I do release as well in 4 years before, 3 years before. Once I started in tele-rehabilitation, a same patient getting 100% successful results without release, then why I have to release? What's the point of release? Then slowly started understanding the science behind it. I purposefully go and read Travel and Siemens book and I understand this is a bullshit.
Yeah.
This is a bullshit. Literally a bullshit.
It doesn't change anything, right?
Doesn't change anything. Why I have to release?
If I release, I temporarily relieve the tightness, but the root causes of that tightness, whether it's overcompensation in that muscle, where obviously there is weaknesses that have resulted in overcompensations, I'm not doing anything to change them.
Exactly. Most of us doesn't understand tight muscles are weak muscle too.
Correct. Yes. That is the
Tight muscles are weak muscles, period.
Ah.
Right, period. I give people all this example all the time. So I don't work out often, right? My muscles have enough durability. Even if I have not worked out in 2 months, even if I'm sitting on the chair all the time, I'll still bend and touch my palms on the ground. Okay, not a problem. It's because my muscles are durable. It's not when people touch my muscles or say, oh, you can bend forward and put your nose on your knees, your hamstrings are not tight. No, my hamstrings are very tight right now, right? It's just my hamstrings are eccentrically strong enough for me to be able to do that movement.
Exactly.
Right? So they're strong. That doesn't mean they're not tight.
Exactly on point. How our peoples have different anatomy, the same way every people have different tightness experience. Every people who can touch the nose on the floor came with the complaints of tightness to me.
Yeah.
People who can't reach the knee, they said, I don't have any tightness in my hamstring. People differs from the perception of what tightness. That again clarifying what activity in their life they need to perform, what goal they have.
Yes.
Person who's touching the nose need to touch more.
Yeah, correct.
Do have a lot of other goals in his life or her life.
Yep.
So you were talking about Tele-Rehab and how you realized what I love about your approach, and I'm going to be very this is true. You said two things. You said I checked out modalities from my practice simply to start using my brain and not rely on these things, right?
Simple.
And it made me understand so many things that I was bound by as long as I had modalities around, right? And the second thing that you mentioned, which was even better, which I feel like we are also learning. When we started this tele-rehabilitation company and we started hiring physical therapists, they came with a lot of misconception that this cannot be treated online. This cannot be treated online. The first thing, and beautiful example, because we were always good at treating knee. I did not need anybody to tell me knee cannot be treated. I treated thousands. We have returned thousands of people back to sport after from ACL or from even Contour Malaysia patella. What people came to me with problems was lower back, spine, and neck shoulder. It's very hard to treat online, right? For shoulder, you need a myofascial release. It's not possible to treat frozen shoulder.
My opinion differs. Any condition, very easy to treat online. One of the easiest condition to treat online is shoulder. Neck.
That's what we are finding out now in the last 6 months.
Great.
Now my team is because we created frameworks. We create frameworks for everything. We created frameworks for non-operated shoulder and for conservative shoulder, frozen shoulder and everything, supraspinatus tear, rotator cuff, whatever is happening. We've created protocols to identify what phase of the rehab the person is and how to recover them. Now my team comes to me 3 months ago and they're saying, you know what?
Beauty.
We are getting amazing results for shoulder.
Beautiful.
Right? We are getting amazing results for shoulder, something we thought was not possible.
Exactly.
And I've been telling them from day one, it is just the limitation in your mind.
Absolutely
because
correct.
if you can help people build load and strength progressively, they can recover from anything.
Absolutely on point. That's how I told to my team as well. I'm not telling them this is how you treat. Tell them this is how you think.
Yep.
Simple. In online consultation, I want to check abduction external rotation range. Rotation range. Just think, I'm asking them to prone lying. Set to the camera, prone lying, keep the elbow on contact, lift it.
What is so hard
Done.
to analyze?
Done. A person can't even reach there. Just lie on, back, sit on the floor and keep the arm like this. L shape with contact. Less intensity. A person, knee, I want to check, you have ability to do pistol squat. You don't have ability to do single leg sit to stand squat. Even you don't have that ability to increase the height and do.
Yeah. There's a progression.
Yeah, there is no standard way to do it. We can create our own.
Yes.
Overhead mobility, easy. Just prone lying, keep the thumb inward, just rotate outward. This arm is going this much, this is not going. Right shoulder pain can be a culprit.
Yes.
Risk factor too. Think. Start think.
And there is a common blocker in people's head as well, that how can you guys do it online? So it's not just the limitation at the team's end, but also at the patient end as well.
Exactly. Problem
this cannot
solving.
be done.
We need to develop problem solving.
Are bhai, agar
Everything
offline
is problem solving.
see, it is not getting fixed online. That is why you are talking to us. And then you're offline, yeah. That is why you're talking to us. And then you're questioning that as well. Ki yaar, if it is not possible offline,
How is it possible online?
online.
It's
So
got nothing
then
to do
you
with
are
offline,
you will
online.
never get better.
It's the
Who
approach.
said offline you have got a correct right approach of treatment? It's a right approach of treatment, right level of understanding your needs and right diagnosis can treat in anywhere, anytime.
Yes. The only problem is if I ask you that, okay, you live in Mumbai, right? You find the right person to treat you in Mumbai, which is, okay, if you go out in Mumbai or Delhi or any metro city, it will take 1 hour for you to reach there. Can you travel for 1 hour, then work out there for 45 minutes and you don't know that, okay, do they even know everything? Hit and try.
Right people to
The tele-rehabilitation, as you mentioned, you people are 10 years ahead.
Yes.
10 years
Yeah,
again, hope thanks to Corona, help us to make them understand a bit faster.
Yeah. And then travel back for 1 hour. Do you have 3 hours
Exactly.
every day for the next 6 months? If you want to recover completely, the answer is no.
Nobody has that time. I think when
Once the pain gone, I will not travel.
After 10 sessions,
I'll not-
I'm
So
fine.
there's the 2 points that I made. First is when people are recovering, the value of the service for them diminishes because they are like, oh, I'm getting better. Why do I need to keep doing this?
Yeah,
Right?
exactly.
And the second thing is what you said. But why I said we don't do 1 month programs. We don't have any 1 month program.
Oh, great.
Because we need to commit people to their end goal. Only then they will recover. Otherwise, as soon as they start getting better, they stop seeing value in it.
Correct.
I'm already better. It's okay. No. You're not better until you can run a marathon.
Exactly.
That's the change. And that's every
Very
physical
important
therapist
point.
we've had on this podcast. It's surprising because I did not think about it like that when we started this podcast. But we got Navnita Gautam, we got a lot of physical therapists on this podcast before you as well. All of them say Tele-Rehab is the game changer. Tele-Rehab is the game changer. Why they are saying it is because they also realize for them to have a patient for 6 months, it is much more viable to have them digitally than to have them physically. Very few people are going to come to you physically for 6 months.
Exactly.
It's only the top athletes that will have the
Exactly.
motivation to come to you. Every other person is going to be like after 2 months, oh, I'm good, I'm okay, it's okay. No,
Yeah,
no, no.
absolutely right.
Right. So Tele-Rehab helps you to create commitment and to get the end outcomes.
Time saving too.
Yes.
You can consistently do what you want, and also what I'm doing actually, a person need a 6 months follow-up or something. We educate them about the workload management, RP, RIR, everything. We made an Excel sheet of program. We charge for that monthly, and weekly 1 quick call and follow-up, and you send the videos. But a person have
what
a
we do.
understanding,
Yeah.
better understanding on it, have a training experience on it. That model works better for us. We
Same.
do.
That's what we do
Oh,
too.
great.
Yeah.
Excellent.
We stay in touch, but we do weekly check-in sessions, demo sessions basically. We bases the feedback that you provided last week on the progressive movements. We will give you feedback on them. We will switch up your workouts. We will educate you on the workout for this week, what needs to be focused on, the progressive movements that you need to focus on.
Great.
Then you do the workouts and provide feedback. So it's a
Great.
weekly thing.
Great.
And it works
Great.
brilliantly. We're getting
Excellent.
results for every kind of patient.
Yeah, at the end of the day, you need results.
And you need
Absolutely.
expertise. The right way to get the results, offline, online, has no bearing.
Just we have to make them understand the importance of doing exercise and health, and in a positive way.
Yeah.
Something in life got better just because of this exercise. Just we no need to tell them to do exercise. They
And
will do
credibility on physiotherapy, right? But, so did your social media help you out to build credibility on your expertise
absolutely.
and physiotherapy?
Yes, a lot of people are trusting just because of training, watching the
reels,
profiles, reels, and coming to us with a trust. That's one point, maybe advantage for me. That current new upgrowing physiotherapists are lagging on it. Maybe.
No, but I think it's the same in every profession. now. Every person we meet, we were talking to a friend of ours who's a football agent yesterday. We were saying the same thing. If you want to separate yourself from everybody else doing this, you have to put out educational content.
You're
This is
right,
a
the right
beautiful
word.
medium.
Yep.
Right.
We
Even
have to put
doctors-
some effort.
Yeah. I met a doctor a week ago on a beach, and she's a general surgeon, studying to be maybe a plastic surgeon. So I was telling her the same thing. Start spending 1 hour a week and putting out content. Just whatever topics you think need to be educated on, start speaking on them. The quality of content will refine, but what it will help you over time is separate yourself from the thousands of people doing this, because now your voice is getting to the right people.
But what do you think about actually now so many people are starting putting video in fear mongering negative aspect as well? Because see at the end how as a person you are is going to express in your content.
Correct.
Right. You are a person, as you mentioned, stop moving mentality person.
Yeah.
Take risk mentality person, and fear mongering person, and believing the MRI limited thinking person. If you are putting social media content, that's going to negatively influence. What do you think about this, you both?
I think
So you need to attract like-minded people. You don't want to attract people who literally don't want to move. What I believe in is you just do your work and rest everything else will be fine. You will always, 95% people will always love you. You do good job, 95% will always love you. Only 5% will be like, okay, what is he doing? Why is he doing? So we have to work for the 95%.
Absolutely.
And for the people who put these kind of content that don't move, just go watch their comments.
No, but it's not about that. So for me, social media is a reflection of what is happening in society.
Absolutely.
Right? So it's the same thing that is happening in society. You will go to Azar. Azar is a brilliant exercise prescribing exercise science and physical therapist who will give you, no, don't rest. This is how you can start loading. This is how you can progress the loading. And you go to an XYZ doctor that did his, MBBS and surgery expertise in 30 years ago, and he's saying, no, just get operated in 2 months, you will be fine. You are getting both kinds of opinion in the real world. It's the same thing that is happening on social media. You have to, as a user, educate yourself by wanting to consume all kinds of content. You cannot avoid content, right? The way the Instagram algorithm or any algorithm works, if I start looking up knee pain, I will get Siddharth's content also. I will get Azhar's content also. I will get XYZ doctor's content also.
Agree.
Now, I am getting hit by different viewpoints from all spheres. It's up to me now to become an educated user and understand what works for me. I think that social media
That's also influence acute pain into chronic.
Yes. Social media does a great job at reflecting what is happening in society. But what is beautiful about it is you can access it from a click. Right? You can access all kinds of viewpoints from a click. But at the end of the day, you have to make the decision on what works for you. That's always going to be the consumer's choice.
So you're talking from consumer's perspective.
Yes.
From a consumer's.
Okay. So I was talking from a creator's perspective.
Okay.
If you're a good creator, you're spreading the right word. You don't even have to think about anything else.
No, but I feel like creators are entitled to give their viewpoint. Right? You cannot stop people from speaking their viewpoint. And that's why social media is hated now by a lot of people. Is on our post as well. On my post, somebody will come, oh, this XYZ fitness influencer doesn't even know anything he's talking about. And now there are so many of them and they should be banned. People write that on my post. I'm like, man, you don't know me. You don't know what I've been through.
Exactly.
You don't know what I am good at. You have never talked to me. You don't know what we are doing at Granimals. You are just commenting. That's also the pluses and minuses of social media. There are people who are looking at my content and be like, oh, sir, you are the person I was looking for. I want to please talk to you. And there are people who don't even know me who are like, oh, why is this fitness influencer talking about physical therapy?
You just mentioned that social media is just a reflection of what is happening in the society. This is also a part of it, right?
Everything.
Some people are looking for hope and some people are looking for people to hate.
Correct. Agree.
Both sides of the coin.
On point.
On society, right?
So you have been creating content on Instagram for a while. What do you think worked best for you? What kind of content?
Yeah, being different.
Okay.
From other physios.
Define what is different in your case.
Against dry needling, if I explain. So against my facial release, if I say something that goes picked up and people will come and comment, oh, you don't know what is physiotherapy. Okay. No problem, you can come to internship, we'll teach you what is physiotherapy. It's always a problem with the experienced person. I respect them a lot. It's nothing to disrespect them. Definitely, if you have 30 years, 20 years experience in physiotherapy, definitely you know better than me. You have seen a lot of patients. But you're not updated with research and you're not ready to change your mentality. That's your problem.
So they are not better than you.
Now they are not better than me. Because 30 years before IFT helps, it helps. Maybe the time people did lot of works, there is no proper transportation, you have to walk, climb stairs and everything you have to do. Then the overload causes pain, then you need to rest and IFT works better maybe 30-40 years before. But now people are getting pain just because they are not moving their body.
Yeah, that's a very
just you have to
different
think reverse slightly. You still saying I treated on that day, that works, but research changing, evidence changing, practice has to change, thinking has to change. People's are not same. Now last 10 years we have social media. Before nothing to consume, people also get affected psychologically. Now the thing is to do ChatGPT to search and get everything.
Yeah.
People will confuse and come to you. Before it's not. What you say, it's a mantra for them.
Yeah.
So many things are there. Situationally, you have to adapt. And altitude, for example, in Shimla, on patient having a pain, you have to think differently.
Yeah.
And normal ground level a person or Chandigarh a person having pain, you have to think differently. Maybe the water intake will be less over there because they don't feel thirsty. So
Air pressure.
So they might walk more than-
hypoxic environment slightly. So many things we could say. What adaptation they have, what adaptation we have.
Correct.
So until you are not ready to accept your mistake, if you are doing mistake, critically think. That's a problem.
So what is the biggest mistake that physiotherapists are doing in India?
Still relying on old things and not
Bottom
ready
line.
to, huh?
Tagline. Still relying on
And
it.
old things, not ready to improve ourselves, not giving enough room to exercise and movements. Still see, every clinics they diagnose, it's not wrong about them, but this is what they have to change. Every clinic 5 diagnosis word which they use for every patient comes, diagnostical word. And lower back they know 5 exercise, knee they know 3 exercise.
Let me mention the 5 exercises. Cat cow,
Cat cow,
Glute bridges.
glute bridges not to begin with, mostly cat cow,
cobra,
cobra pose,
SLR.
bird dog. SLR, I don't know why they do, because it can trigger lower back pain as well. If
Depends again.
Yes.
Context so
Right.
can answer better.
But cat cow, bird dog, dead bug, cobra, right, and SLR, yes.
Yeah, that's a basketball player come with a ACL injury. What's the point of basketball come with just normal knee pain. What's the point of giving towel exercise? Already he can do squat of 100 kg.
Quad press, straight leg raise, side leg raise.
Yeah. So
Either put
that's where,
15 kgs on an SLR.
That's where again hip flexor gets loaded.
Yeah.
So that not understanding the biomechanics what we really apply. So most of the physio, literally I'm saying, axis and planes, force velocity relationship, Newton's laws, concave, convex rule. So many things we can add on it.
Yeah.
Why we studied, we don't know.
Yeah.
Yep. And when someone comes in the market and talks about it, you get hate
Yep,
because he's the only one who's talking about it
exactly.
and you're not.
So like you talk about not to do MFR, right? Or it's not the most helpful thing. We do MFR. It's not that we don't do MFR, because I feel like for me, I don't do MFR personally. But I feel like it's so much consistent training over the last 10-15 years where my body now has a lot of load taking capacity. My muscles have a lot of load taking capacity, right? They can keep taking load and they can keep readapting. For a person who has a lot of tightnesses, we'll prescribe some MFR plus obviously loading.
Again, I'm saying it's okay to prescribe.
Yeah, of course.
Completely, I'm not against it. But don't
rely on
with
it.
a hands-on, palpate, this is where you have trigger point, we have to release this and all. That doesn't work. Yesterday, we upload a post, research paper.
On this.
No, there is no trigger point.
Yeah.
Because you are both of your therapists considered to be, you palpate different area and say trigger point, you palpate different area and say, like
Correct.
MRI, 5 MRI and 5 different
different
radiologists,
results,
5 different
yeah.
reports, 5 therapists, 5 different myofascial trigger points.
Yeah.
Yeah.
The thing is, listen carefully, ears on, understand the things, why it's getting pain, what is his need, what is his goal, what to say to him, accordingly carry on.
Yeah. And one more thing that you have spoken about earlier was they have to work out themselves also.
Absolutely on point.
Yes.
Until we can't grow our profession at all.
Not only profession, I mean, he talks to a lot of physiotherapists. They have a very narrow mindset. They become a very insecure person over time, right? When they're going to treat someone, even before they have started it, they're like, they have this insecurity. What if it doesn't work?
Again, it's a problem is not from the physiotherapist, the problem with the education system. You know one thing,
Yeah.
you can't ask question against the staffs.
Yeah.
They'll throw you out. They'll reduce your internal marks. They didn't allow you to write an exam. They'll treat you like a basket. We're worried to ask questions. Culturally, 4.5 years, every physiotherapist suffering with that. Every physiotherapist are coming at the 4.5 years out of the college with you should not ask question. Like a mouse, you put it into one area and treating like that. You should not ask question. You should be like this. You should not grow up. The attitude is not that.
They are very timid people. So I say this all the time, and this is with love, because one of my aspirations when we started Granimals was I want physical therapists to be respected as doctors, right? Because genuinely it's a brilliant profession.
And
I
they're
feel like-
spending more time
yes.
with the patient than the doctor.
Agree.
obviously.
No, but it's also
Perfect.
the world needs more physical therapists now than it needs doctors.
Yes.
The world we are living in, people are in musculoskeletal pain because of lack of movement.
Everyone.
Yes. The world needs physical therapists right now more than they need doctors. I don't mean it to be a controversial statement. I genuinely believe that. And I feel like they are not valued in this country at all. Whereas it's the most important profession of our time, arguably, right? The problem is they are not people who are confident. Anything happens in terms of a flare up. A physical therapist's approach is not, we've been doing everything right, don't worry, we'll fix it, let's go at it again. It's a chronic pain, it can flare up again. They themselves are so scared, they will say, go take a doctor's advice, go take a doctor consult. The doctor can't do anything in that situation.
You can only do that situation.
Exactly.
You are not believing yourself. How patients believing you, and doctor said surgery, they will do surgery easily.
Or the doctor say MRI says chondromalacia patella. Now doctor says don't do anything. Now they are not going to come back to you.
Yes, that's a problem which we are talking. Again, it's based on limited thinking ability from the teacher's aspect, college aspect.
Yeah,
not
it's
every
a
colleges,
educational
but
problem.
most of the colleges like that.
Educational problem. I get it now because like he said, in 3 things that I would relate to physiotherapists, obviously the good physical therapists in our country, especially ones from good institutes, they are very technical. Their understanding of anatomy is amazing, right? I will say it's better than most countries on the planet, right? But what we suck at is problem solving, critical thinking.
Exactly.
Because we've been boxed. This is how you have to think. This is anatomy. These are the
how
rules.
Colleges are treated everyone 4.5 years. You can't ask questions. You should
How
not
will you grow?
think.
But that is the place to ask questions.
Yes.
That's okay.
How
But
will you
that's
grow?
that's how everything is happening currently. That's the biggest problem which I'm thinking. Even in social media, you can't go and comment on some other physiotherapist about critically.
Just ask questions.
It's a herd mentality.
Yeah.
If you're asking a question, you're attacking physical therapists.
Yeah, I'm very happy someone asks me questions. So I can change. I can improve my mistakes. But if I do the same thing, people start thinking, you are a physiotherapist, you're only creating problem in physiotherapy. You don't know what is physiotherapy. You are the big problem in physiotherapy.
It has happened to us so many times. So many times. We are the problem in physical therapy right now. Him and I.
Until we didn't ask question, no one will improve.
Yeah. I mean, if you don't ask questions, that is what is happening in the country as well. No one is asking questions. So we all know where we go.
That's happening at a big scale in the country. If you ask a question, you are against Indian people, you are anti-national, you are anti-physiotherapy. Asking questions is a problem.
Someone can just be curious.
But I feel just because of my approach, newly coming, lot of physiotherapists started thinking better.
Yeah.
I can see the changes slightly. I'm very happy about it.
Same. There are definitely a lot of good physical therapists. The people that we are bringing in now, they are very different mindset. They are very growth mindset. What they have understood is they cannot be married to the idea of I'm going to train in a clinic. They have to accept that the world is moving towards a digital ecosystem. Exactly. The world is moving towards physical therapists are not just physical therapists. They are coaches. Let me use that word coach.
But definitely people who watching this definitely take it wrongly. That accepting mentality is not come yet to physiotherapists.
The best physiotherapist can be the worst coach. The best coach can train better than the best physiotherapist.
Yeah, because
I have seen excellent coaches who understand the workload management very well. They can handle pain better than anyone.
Yes, 100%. Because see, coaching is about knowing how to progress depending on the person, having the ability to make them buy into your ecosystem.
Exactly.
Right? That's what physical therapists struggle with. They are so used to a patient will come to me for 10 sessions. They will not ask me any questions. I will give them any XYZ approach. And whether they improve or not, I don't even know, because after 10 sessions, they never come. In our ecosystem, patients ask you questions. Why am I not recovering?
Correct. Nowadays, again, when I'm talking to some people working in Bangalore and all, to what happening actually, what the markets looks like and how it's going and everything. Now the people are segregated the things. Physiotherapy means modality for 7 days. Modality for 7 days. And rehab means 7 to 1 months of basic exercises. 1 month later, fitness you have to convert.
Fitness?
Physiotherapy means modality. So they will explain to the patient only.
Modality?
7 days physiotherapy you can take, and then you can come to rehabilitation. And rehabilitation later, fitness they will convert, they get incentive. Like that it is working.
Okay, so
but then they change the name of physiotherapy only, treating pain and modalities.
That's bullshit.
I was very disappointed.
That is absolute bullshit.
Absolutely correct.
I don't even care if you just change the names, do it the right way. But do you think that in 1 month, okay, you can do this and then bring them back to fitness?
This is what happening. Physiotherapy means initial 7 days or 10 days of treatment to reduce your pain. But the 7-6 days, we won't ask you to move. We'll put you in a bed. Whatever the modality we have, we try all the modalities.
So we were talking about
Pain kam ho jaye bas.
the physiotherapy and the coach thing. I'm not from a science background at all. All right. I trained a lot of people for like 3-4 years. I used to be a coach. I trained people with different issues. And I have given like magical results, I would say. It reminded me of Anurag. So there was this guy operated for ACL and meniscus tear, hamstring graft, came to me 8 months post-op
Okay.
with tears in his eyes, right? And been to multiple doctors, physiotherapists, tried everything. He was not able to extend his knee beyond a point. He was not able to bend his knee beyond that point only. His knee was kind of stuck in this range only. When I saw that guy,
The walking gait was messed up.
everything was fucked up. He had scar tissue, a big scar tissue in his knee. Doctor said that you will have to,
Another surgery.
you need another surgery. I saw the MRIs and I saw him. I told him that you might need another surgery, but have you tried enough? Have you tried enough?
Makes sense.
Right? He told me the approaches taken by the physiotherapist. Today he's living in London. So when he ran for the first time, I ran with him. I made him run in 6 months. I told him.
It's possible. It's possible.
Anything is possible.
He's living his life with no pain. He's doing treks. He's doing everything.
Beautiful.
I was not a physiotherapist. I was just a good coach. I load management, right? Biomechanics, progressive approach.
I wasn't even a coach, right? So the point is, you don't have to be, like a proper degree holder to understand how recovery works.
Sometimes problem solving and critical
it's always
thinking.
problem solving and
Yeah,
critical
it
thinking.
is not something we are talking against physical therapy.
No,
we are
no,
telling
no, no.
physical therapy to...
We are talking about how they should also think about it.
Exactly.
They are better than us.
We want
Nothing
everybody
wrong,
to
nothing
improve.
wrong
You
in
are
it.
better. You are a physiotherapist. You guys are better than us any day. But if you think that way.
No, just I'm sharing to the audience. Don't take this negatively. Oh, so how some coaches can treat and all. No, not an issue. Just an example which he shared.
Yeah.
You give your bike to mechanical shop. Mechanic. He didn't study the degree. Did you check the degree and giving your bike to him?
No.
But you have trust that he will. He knows about the bike.
We call
he
it
can treat
ustad.
it.
We
Yeah.
call it ustad.
So don't take anything negatively. Some coaches are doing things and everything, but at the end patients are getting better. How we can improve our skills to
So that we get the same outcomes.
same outcome, so we can beat
Yes, correct.
others.
100%. Don't
The advice I should give to the
don't be jealous of somebody who can get a result and feel like they're threatening you. If you are good at your job, you're already getting enough people into the door. You don't need to be threatened by anybody,
Agree.
right? You were telling about asking questions. So recently, we create frameworks for injuries, different injuries. When we create a framework, so it's a research team. I have 2 people on my team. One is a master's in biomechanics and MPT, and one is a PhD in early osteoarthritis. Right, 2 brilliant people.
Great.
Manipal graduate and one from another institute. So very smart people, right? And it's me, 3 people, one without a college degree. Okay, so 3 people. We create frameworks for every kind of injury. When we create a framework, our goal is not, now this is what everybody uses. Our goal is, here is a base logic. Now you guys use it. Tell us what you feel like is not working and let's debate it. Right? My logic when I create a framework is I'm going to train the team on why we have created this, what is the goal of it, how it is going to work. Now you go and use it, write as many questions as you have, let's debate it. My job to protect the logic I've defined with my team, your job to make us realize that we've done something wrong. That's how we all improve.
Agree.
How can it happen any other way?
Agree.
Right? Me and my 2 people don't have more expertise than the 75 other people. The 75 other people come to us, tell us where we were wrong. Everybody improves.
He's talking pure democracy.
Absolutely.
Everybody improves. I am talking improvement. Right?
No one should talk what I said should be right, means no one will grow.
Yep.
Perfect.
What is the most common problem that you are solving for patients?
Lower
Right?
back pain, ACL, shoulder. No, I see. I was having one good mindset. A physiotherapist who passed out, they will treat all the pain. Pediatric cases, stroke cases, even neck pain, everything they'll treat. Once you become experienced person, expertise are improving, you'll come to narrow your path. Just think, as you people doing, just all the ACL injury peoples only in this world comes to you. You can be expert in that. You can treat that good.
Yeah, you can be the best at that.
Yeah, you people are the best at it. So, knee, I have a framework for knee. If a person come and sit to you, say I have knee pain, what diagnostic clarity you have to get?
Yes.
I have shoulder, I have lower back pain, I have.
Same. Foot, ankle, I have.
Yeah, so that's enough.
Yeah.
So I'm strong at shoulder, back, and knee. Other pains also I can treat, but most of the people nowadays comes to us through social media. Through social media, if someone comes, they are suffering a lot. They visited a doctor, many psychologically affected. Now I'm thinking, now I feel bored to treat people who affected psychologically, honestly, because of every day 10 consultation and sitting and explain to them.
Yeah, it's very, I understand. It's exhausting.
We have done that for a long time.
It's exhausting. It's
Yeah,
exhausting.
exhausted. Now I worried a lot. But most of the people nowadays coming just after getting treatment with many people is not getting better. Just you are saying movement is good in your video. How to come?
I want to move. Yeah. Same. People get hope when somebody speaks differently.
Yes, hope.
The world is changing. We are, I mean, three of us, we are sitting here. The only, the goal for three of us is to change
It's the same.
the
It's a common thread,
Yep.
right? So we treat people for AS, for MS, for RA, for foot drop.
We have ankylosing spondylitis. You
Yeah.
mentioned the guy. We have a guy who's planning to run marathon with AS.
Oh, we have a lot of people. You might know of one. We have 10-20 cases of AS.
Yeah.
Right. We have
Running a
cases
marathon.
of AVN.
Yeah.
We did a case study on AVN.
AVN, what happened at the end? Surgery, any one point of time is required.
No, but this person has been with us for about 6 months now. It's pain-free. Very good hip strength. Very good posterior chain strength. Very good core strength and stability.
Then the progression we can reduce a lot.
Yes. The
Progression of the disease, what I'm saying.
the progression of the disease, the progression of the symptoms. His symptoms are absolutely fine right now. He's progressing really well. At the end of the day, science says you cannot stop AVN, right? It's a degenerative condition, right? You will have to get surgery at some point. That doesn't mean I get chained to the idea of medication and I wait for my surgery and my demise,
Correct.
right? I can get stronger. I can
effort
delay
from
things.
yourself,
I can have a good quality of life, right?
Agree.
We are
Eat
enabling
well,
people to
sleep
do
well.
that every day. So I don't understand why everything can be treated, man.
Agree.
To a certain extent, everything can be treated.
What do you people think about posture?
I think we might have different opinions on that. What is a posture? I mean, that is my first question. If I'm sitting like that, is it wrong? No, I don't think so. I'm feeling good. If I'm sitting like this, is it wrong? So we humans, we use posture as an excuse for not moving. That is what I think.
Or it is used as a major, I would say, root cause for pain in the medical industry.
People say that, okay, you're in pain because your posture is like this. I am saying you're not moving, that is why you're in pain.
So there was a massive debate last week in our group of physical therapists about posture. So we were, somebody posted a picture of somebody sitting like this and they said, oh, you are at more risk of your shoulders being internally rotated, your scapula not firing properly.
Again, limited thinking.
Yeah, 100%. So other physical therapists were like, there is a lot of research going on right now which says that posture has nothing to do with anything.
The most uncomfortable posture, sitting in upright posture.
It's very uncomfortable. Correct.
But I'll ask to everyone who prescribing or telling to the people to sit upright. Are you sitting upright?
I never do that. But I can do a 50 kg Jefferson curl.
That's too good.
Right? I can do, my shoulders getting internally rotated. I can do 10 muscle ups. I don't care. I will sit all day like this.
No, but your point is very good. Is nobody sits in the right posture, right? Nobody always stands in the right posture. It's not possible. It's very tiring.
Great.
Right. So what is
best
your
posture is comfortable posture at the time for you.
Yes.
Once it gets discomfort, our body itself knows. We'll change to
You
the
will
different
change the
position.
posture.
This podcast starts. I sit like this for a couple of minutes. I sit like this. I sit like this. Our body knows to do something and change. It will change according to you. When it's become problem. I was treated one surgeon from US in tele-rehabilitation. He have a right side lower back pain. Right side lower back. He has to do every day, a weekly 4 days, 6 hours of surgery. Foot and ankle surgery he has to do. This position itself, he can't even change. He right side overweight shifted position of surgery, minute work for longer period of time. One point of time your position is going uncomfortable, but your work nature doesn't allowing you to change.
Yeah.
Or you have to stay in that comfort for longer period of time. Then that can cause slight discomfort. That can cause slight discomfort. But again, the posture is not the problem. To do that work, you don't have ability to stand.
To do that
Exactly. That's always the answer.
Every pain we can classify into poor workload management, lack of strength, lack of movement variability,
Yes.
psychologically.
Yes.
These 4 things. Anything comes, only classification comes, the pain comes just because of this 4 reason. A person, on another example, a 25-year-old male who has 130 kg have extreme knee valgus of both sides, have extreme congenitally, but he was disciplined past 5 years. He's lost almost 45 kg. His body weight, his quadriceps looks good now. He's running and everything. He come and consult me. You don't have pain, but everyone's saying
That you
Yes.
you will get pain.
Biopsychosocial.
And I told him very simple, logical point. See, you don't have pain so far now. Tomorrow you went to one function. You didn't sleep well. And next day morning you did 5K with some motivation. You got pain. What is the reason for the pain? Poor workload management is the reason for the pain, not your knee valgus. Don't limit again. I think I will educate him. I sent him. I can't say he's still all right. Again, 10 people will come and influence him.
Yep.
He need a couple of more advice. So whenever you are worried, just contact me. I'll consult. I'll give a education about you are doing good things. Please do good things. Stay active. Understand what is load management. Works accordingly. Nothing will happen to you.
People talk about flat feet. I always give them example. All Africans have flat feet.
Yeah.
Most African athletes I played with, they had completely flat feet. They're great athletes.
Yeah,
They
because
don't
I
have
want-
knee
Seen
pain.
their vertical jumps.
They don't have knee pain.
Ah.
So what does that have to do with
You have to show
anything?
slow motion of marathon runners' feet, and Usain Bolt have flat feet.
Most Africans have flat feet. They're the best athletes on the planet.
It's not going to limit. Again, the same example. Do watch Paralympics. Worrying about flat feet and just with one leg, people are creating records.
Yeah.
What's the limited? Again, we are coming to limited thinking ability.
Yes.
It's all coming back to that, and the 4 reasons you mentioned before pain. They're great.
Because there is no right way to move. Our body adapts the way you move. We are watching on reel 150 kg engine, a guy bending and lifting comfortably without discomfort, because he's adapted to that. We can
Train for
move. We can move however we want. Our body will get adapted. Our body is excellent machine. The body knows how to help you to move better. Just we have to give inputs and move.
So one thing that I want to talk about is physiotherapists in India are very ill paid, right? You
Are
go
very
ill paid, very less
Poorly
paid.
less paid.
Poorly
agree.
paid. You go to a hospital, they are working for what, 12-15,000,
15-20K.
15-20K. So what we are trying to change is pay them well, all right, incentivize them well. You being a mentor to physiotherapists, what would you recommend to them if they want to have a great career?
Start work on yourself. Even people's, we are working 25 people, 28 people working together. I tell everyone in last meeting also, how long you going to work under me? How long you are going to work under me? Start work on yourself, because this system isn't going to change within couple of years. You learn something, start work on yourself, build your own clinics, or tele-rehabilitations are going good. You know how to treat people in tele-rehabilitation. Start your work. You know good things, start put content in social media, get some engagement, people will come to you. At least what you are doing puts in WhatsApp story, at least you have 300 contacts, 300 people know about you. So at least they have pain, they'll remember you, they'll coming to you. Just to showing I'm doing this stuff, I'm a physiotherapist, just remembering them, simply it's enough. Improve your self-confidence as much as possible. Learn about some financial thing, business thing. That is the more important thing.
I think to get there, like you said, there are people working with me. I know this for a fact as well. All of the people working with me, they are not going to stay with us for 5 years, right? They might stay with us for 1 year or 2 years or 3 years. I say the same exact thing. Your goal should be to be your own boss, but to be your own boss, you have to be a really good physical therapist and coach.
Exactly.
You have to know how to bring a client to you. You have to know how to serve the client with good decision making, with good problem solving. You have to know how to be a great coach and get them to their recovery point, and you have to understand finance as well. So that's why you work in places where you can accrue the skills to become the person who can be their own boss.
Exactly.
Yeah.
We can't change the system. System doesn't change with short period of time. We have to improve ourselves to it. Because why exercise prescriptor people are coming? Because he is the only guy in South India saying move your body.
Yeah.
If 10 people are saying, people are come to you as well.
Yeah.
So I'm pushing whoever comes to my clinics and 1 year, 2 year, I'm pushing everyone to open a new clinic. Grow yourself. You have lack of confidence, I will come with you. I'll help you. Do it.
Yeah. No, that's great.
Grow up. That's the only thing now I'm doing. And also we are doing free internship program. Every month 2-3 people comes and learns, go and do their stuff.
We're also thinking of doing something similar where we have like a certification, basically just teaching people that movement, exercise, progression in exercise, proper analysis, proper setting goals for your patients. That is what is going to help you achieve the goal, because there is enough food for everybody.
Exactly.
I am not competing with you. You are not competing with me. You are also talking about pain. I am also talking about pain.
Exactly.
The problem is everybody is in pain.
Exactly.
Right? Even if 10% of the people in the world come to you and I, there is still 90% of the people that will go elsewhere. So you will never run out of food as long as you have value to provide.
Exactly.
Right?
Find your path.
Yeah.
Find your path. Work on. Put max effort. You will grow. Correctly. But learn about improve communication skill, listening skills, financial skills.
Correct.
How things works.
One piece of advice that you want to give to each and every physiotherapist in India.
Please every day do exercise. Move your body in a certain way. Number one thing will teach you. Second thing, throw out all the modalities out of your already we said. Your clinic, your brain. You can start literally think how your brain works.
Yeah.
And third thing, sit and read every 30 minutes. Not only after 4.5 years, we know everything about physiotherapy. If you are ready to learn lifelong only, you can grow. These are the 3 important things which I say to every physiotherapist. You consistently doing for 6 months, 1 year, definitely will get better. No one's strong in every conditions. If a patient comes with me 4 years before having a back pain, even I confused how to diagnose them. But you put yourself on the situation. After that, you're going back to read more things. You'll understand 10 patients crossing in your life, you are getting better understanding. 100 patients crossing in your life, you are getting much better understanding. First 100 patients is next 1,000 patient your clinic.
Yep.
Do the good job, put more effort. It's not just limited thinking ability. Oh, today this patient comes, we'll escape today with this modality. It's not like that. If you want to really grow, do exercise, start read every day. This is going to improve you.
And one piece of advice for anyone who is in pain today.
Start move your body. Don't keep your mind limited thinking ability. Everyone have pain in their life. Pain is a multifactorial thing. Pain only is not only coming with by physical damage.
Yeah.
90% of the pain nowadays is not at all physical damage. Psychologically strong, move your body. First think about your lifestyle. You're strong enough to do the activity or sleep and lifestyle, stress, everything is okay. Then think of consulting a doctor. Otherwise try to manage yourself. Move your body, you'll get better.
One chronic pain or injury recovery story that is very close to your heart.
Many, actually, suddenly one thing I want to share means.
If someone asks me the same question, I would do the same.
No,
I will have to think.
many things we can share.
Yeah.
But one means currently it's not coming in my mind. Maybe one female who 32-year-old female who want to do exercise regularly, want to go gym eagerly. 4 years of full body pain, psychologically affected a lot. Just 1 month before meeting me, went to Ayurvedic rehab center in Kerala and spent
why is Ayurvedic treatment so big in South, man? Please explain this to me.
Don't have an answer, sorry. 1.5 lakhs he spends and there is no improvement. And she don't have any trust on me also for consultation. not even
Because
having
now she distrusts the system. She
Exactly.
think everybody is out to make money.
And someone told about me, she came without loss interest, she did a consultation. I give a hope, just come for 20 days of 8 weeks. First 4 weeks 3 days, next 4 weeks 2 days. Slowly she started getting better. She started walking without pain. She started lifting weights comfortably, and we not achieved end goal on 20 days of 2 months.
Obviously.
60-70% she's better, and she's ready to come for upcoming more sessions.
Did you use any Ayurvedic treatment?
Nope. I don't even know what is Ayurvedic.
The Ayurvedic treatment, I'm glad it got brought up because it's so big in the south. I don't understand it. Like every person that comes to me and says, oh, they're going to doctor advised Ayurvedic treatment, or my friend went to an Ayurvedic treatment place.
Panchatantra.
See, every non-specific pain, a patient without a specific reason of pain, which means I'm serious pathology, I'm saying. Radiculopathy, osteoarthritis, sprain, like no serious problems are causing pain. We just get better with any treatment which we give.
Yeah, rest treatment.
Any
Rest
treatment
works great.
Any treatment, Ayurvedic it will get better, chiropractic it will get better, or any modalities will get better. It is not that they are getting better.
Yep.
Yeah, we know that.
Yeah.
We know that. We understand that.
So-
They are just resting in
Just
peace.
exactly. Now she is doing weightlifting and everything past 1.5 years successfully, no pain, no discomfort, and she shared to me as well. Instagram, sometimes she do deadlift, sometimes do squat.
Nice.
Because of you people I'm doing thank you and all. But many stories over the period of time.
What do
Yeah.
you think technology in 21st century is playing a huge role in rehab, recovery, physiotherapy?
Absolutely. I'm agree. We are also working on some AI tool to create some protocol, exercise plans, or research article to give, honestly, document the condition of the patients, related evidences and everything. We're working on it. It's very, very important role. Reduces the timing. If,
And you can
you
serve
can be
more
quick.
people.
You can be quick and serve more people.
So we are also on that path.
That is very important.
Yep.
I think. But once we tried and we failed, because I am a guy always goes on the situations. Depends on the condition. If someone in front of me and ask, I have this pain, what could be the reason? Sorry, I need to consult you.
Yeah,
You need to talk.
always.
I can't answer for it, because I need to understand the person is the pain, not the always I say it's not about the rotator cuff. It's all about the person who attached to it. It's not about the ACL. It's all about the person who attached to it. It's not about the pain, any pain in the body. It's all about the person who attached to it. Until we know about the person, we can't treat the pain.
That's beautifully put.
Yes. Real one. बढ़िया reel निकलेगी.
Okay, nice.
I think we're good.
Yeah, that's
Very
it.
good.
That's a wrap. You want to
Yep.
do a rapid fire?
If not a physiotherapist, then what would you have done in your life?
I feel any profession which I choose, I could be best in this profession.
I love that.
Yeah, definitely. If I'm an engineer, same thing in engineering problem I could have shouted in social media.
I feel the same. It's problem solving. Anybody who can problem.
Because I feel strongly I have good problem solving skill and intellectual thinking, accept the mistakes and improve myself every day. So if I have that, any field, every field has mistake, I could have find out the mistake, I will do the same thing, and maybe I would have talked another 2% in this podcast like this. Without physiotherapy, some other field.
I believe you.
Biryani or butter chicken?
Butter chicken.
Ooh.
I hate biryani. Because we have
Controversial.
biryani every 3 days once.
I love that. Favorite place on the planet to visit?
Planet to visit. I'm not a travel guy.
Not a travel guy.
Not a travel guy means don't like to travel, spend time, these things. My happy place is my home. My happy place is spending time with family. Don't like to travel and explore things. Maybe slowly I'm improving.
Yeah, you came to Chandigarh, man.
That's why I couldn't able to answer quickly, because 29-30 classes I went all over India to take the class. Even I come to Delhi.
Yeah.
But I never come with my family, and none of the places I stayed extra one day to visit.
Just came to work.
Came to work and left. Slowly I'm improving.
Your favorite place in India?
My favorite place in India, Coimbatore.
He answered it before, man. He answered. He say home. Home is his favorite place.
Yeah,
Your favorite sport?
athletics. I watch, enjoy, because I love cricket. I watch cricket a lot. I play cricket, but still, something comes inner peace, happiness to enjoy watching something is athletics.
And the idea is fascinating. They are just working so hard for those like 10 seconds.
Exactly. 0.005 seconds. Oh, bad.
For just that one throw.
Yeah, I treated one athlete. She got better. She didn't compete the competition. Just she got fear. What if I lost? No, if you want to become an aerobic athlete, you must be born, not be created. Your parents are more responsible than you.
That's a different way to look at it. I feel like athletes can definitely be created, but what you mentioned about the mindset, I think mindset is very hard to create.
Hard to create, very, very hard to create. That's what brings success in most of the cases.
Yeah, mindset.
And in your case, I think your father played a
Very big
role. When your Bappu got your back, right?
If he was not there, it's tough to sit here and talk. He played a big role. He teach me life, I think. What is life? He didn't say like some other parents, I will take care, you do study. You go work, learn life. Do part-time job.
Yeah.
Full day, night, Diwali, I worked. Still morning 10 o'clock, the next day 4 o'clock. In Chappal Godown, I got 250 rupees payment. Teaches life. At the age of, when I do second year. Teaches life, how hard to earn 250 rupees. That brings me here. Do not work under anyone.
Yep.
Yeah, I understand and respect that a lot.
Your favorite athlete?
Johan Blake.
Ooh.
Why?
The attitude built maybe from childhood without
Johan
knowing.
Blake. I don't think he ever... he won a world championship.
He won once, only once.
Yeah, and I think he
and
was...
Usain Bolt gave a good reply to him. Still...
that period was very unlucky for all of them because...
He's unlucky.
Usain Bolt came in.
He's unlucky. He's unlucky.
Batao yaar. Bolt.
It's like Andy Murray is so unlucky because Federer and Nadal and Djokovic, the greatest players of all time, all in one era.
Recent eyes are going towards Gout. Let's see.
I like Gout. Very talented. 16, 17, under 10 seconds. Have you seen his running form? Is crazy.
Crazy. Yeah. Now come and comment about correct way to run, correct way to move.
His stride length is crazy.
Posture.
Exactly.
His stride length is
People
crazy.
like this has to come and success and prove, to give a lot of success to prove others. It's not right way something.
Yeah, but-
And also one more person I forgot, Eliud Kipchoge. It's my favorite.
Eliud
favorite person.
Kipchoge is any athlete's favorite guy.
favorite.
Kipchoge defied a lot of things.
I watch him started running.
I think under 2 hour marathon?
Yeah, that's
First.
created.
Right.
No human limits. For
Kipchoge.
that, the separate team, separate shoes, separate model, air drying force, line of athletes running with him. Lot of things. It's not natural, but it's not a world record. But
It's crazy.
it's crazy. But now it's going to be just 35 seconds. Okay, 2 hours 35 seconds more. Now new world record has been created. Just
obviously athletes are
35
getting
seconds.
better.
But the beauty is that's the second time he created Eliud Kipchoge to reduce 25 seconds of 42 kilometer.
I love that. You like Kipchoge? I'm a huge fan.
So that's a wrap. Azar bhai, it was really nice having you.
Thank you
This
so
is
much.
going to be a great hit podcast. That's what I wish every time.
Thank you for having me.
It was fun.
Yeah, so
I think we are very... You and us are more aligned on what needs to be done than all of the previous guests. And even though we had some really cool guests, but I think very similar mentality and very similar personality we have.
Great.
So it was lovely having you. Please, kabhi bhi Chandigarh aate, whenever you're here,
sure.
please hit us up. We would love to spend more time.
Sure.
Talk about... I would love to talk about what you're doing in AI because I'm doing something similar. I would love to talk about... Like, I understood a little bit more about how I can set the expectations right for my patients on day one from you, right? So I think there is a lot of exchange of values and knowledge we can do
Absolutely. That's a good thing to learn from
for
you.
mutual benefit.
Yep. And one last thing before we call it a wrap. One guest that you would like to recommend to us that you can set up
For us.
for us.
Swatiswaran,
Okay.
one guy was there, which I know. He's not famous.
We don't need famous
No,
people, as
just
I
I'm
told you.
saying.
Yeah.
He is the one guy which I see differently in my entire career. With similar thinking mentality.
Nice.
In physiotherapy. Maybe I will recommend him, Swatiswaran.
Yeah.
I'll share his ID or something.
Please.
Done. Set this up.
Sure.
It's on your shoulders now.
Awesome.
Yeah.